Hi everybody. I will be talking with Nicole and Megan on the oral presentation for cross-cultural psychology final project. The topic that we chose was mental health and culture and how those two kind of interacted with each other, and we researched three different topics. First one that we did was the African American, the Arab American, and the Asian American. So we broke down these three different cultures and kind of dug into them to kind of figure out how each one works and how their culture kind of affects their mental health. So first I want to start off with talking about multiculturalism. This is going to be a general topic for all three of those cultures. So it is a stance that takes a position on racial and ethnic diversity of the US. And then later on in the 1990s to the 2000s, the concept kind of broadened to include race, culture, ethnicity, sexual orientation, gender, disability, religious affiliation, and the socioeconomic class. This theory was kind of problematic because it didn't articulate radical approach to culture, imperialism, racism, sexism, and economic oppression. So to begin, I personally was able to research African Americans. So to start us off, according to the US Census, approximately 12% of the American population, 33.9 million people identify themselves as African Americans. The mental health of African Americans data has been collected used comparison to whites. So this was kind of difficult because they did not hold their own standard, and it was more of a comparison than trying to figure out more about them as a separate. So later on, once the African Americans' mental health was examined for the benefits and the cognitive implications, it was not until after slavery happened. So this is where most of the mental health problems that occurred in African Americans was more prominent. So African Americans struggle with two different kind of discriminations. So the first one is major discrimination, which includes events like police harassment or being fired from a job. This happened in the lifetime prevalence of 50% for African Americans compared to 31% whites. And it happens more in African Americans with that 50%. The second type of discrimination that happens day to day, which is associated with generalized anxiety and distress of the individual, which is reported 25% of African Americans, while only 3% of whites experience this type of discrimination. So for the final project, we had to do an experimental portion. We chose to do interviews via email. One person that I decided to interview is a teacher at Marist High School. This teacher is a psychology counselor also. In this, we asked them 6 separate questions. So the first question that we interacted with over email was, do you notice differences between people of different culture backgrounds while you are working with them? And this teacher answered, in the classroom, I've noticed that the participation and input from all of my students have been consistent, and I haven't been able to ascertain any differences based on background nor race. Are the characteristics you see within certain groups consistent between people of the same culture, background, or race? She answered with, outside of the classroom and in the hallways, I noticed cultural differences that have been brought up by other teachers. For example, our African American students are very expressive, use movement, and speak louder as they socialize. So with me personally researching African Americans, it's really helped me and noticing kind of what a teacher sees when they are interacting with that culture. The second question that we interacted with was, do you find that you have to change your methods depending on what culture race you are working with? So this was in terms of her teaching methods or how she interacts in the classroom. And her response was, I've not changed my methods in teaching based on culture. I tend to be very student-centered and project-based in my methods. Therefore, I allow the students to take the lead and I support them on their journeys. This allows me to adapt if necessary. I have not noticed any of the adaptations based on race or culture, more so learning level, and if the students have learning exponentially. The third question that we interacted with was, has anyone ever rejected an idea that you have had refused a treatment option due to their cultural or religious beliefs? And this teacher, having both sides of being a counselor and interacting with students, her first response was similar to the second question. I allow the students to explore their beliefs and wrestle with Catholicism in comparison in our religion course as I work at a Catholic school. Her counseling experience. I have, on the other hand, at the practice I counsel at, had a parent of a child refuse talk therapy as the means of helping the child. She immediately wanted help from a doctor involving medicine and was unhappy to hear that I could not prescribe medication. So that kind of gives us an insight of the reactions that people might have with mental health and maybe how people really interpret what mental health is and how you can get help. The fourth question that we interacted with was, do you have trouble working with people when you do not know, understand their cultural practices? And her response was, personally, no. I think we have so much to learn from those around us. Each of us come from different backgrounds, cultural life experiences, and can approach the world in different ways. To be open to learning those different ways and incorporating those at times in my life can be super helpful. I'm also not afraid to ask for clarification or say that I don't quite understand and want to learn more. Authenticity and honesty go a long way. Last two questions here. Question 5. Have you found that it is hard to treat and understand people when there is a language barrier? So in different cultures, not everybody speaks English, so this might be a little bit difficult. So the teacher responded, yes. I had an intake session with a client who did not understand nor speak English very well. I was able to understand general themes and ascertain the presenting problem, but found that repeated questions frustrated the client and inhibited rapport. That could be a little bit difficult in not understanding the language barrier, and you can see here that she had a little bit of a negative experience with it. The final question here, have you ever had to do any research in the cultural background so that you could better understand them and try to help them? Question number 5, if you do have that negative experience that this teacher did have in her counseling and not understanding that language barrier. Her response was, in my experience, I've reached out to counselors, past teachers, and family members in better helping a student. I've also researched various religious practices and understanding others' beliefs.
Hi everyone, Nicole here to share my portion of the project as well as Megan's information, so let's begin. Arab Americans, their natural language is Arabic. Muslims seek preventative health care greater than other groups. They feel uncomfortable in the presence of authority figures. Social workers and psychologists count as authority figures to them. They believe that evil eye, which is jealousy, is thought to cause illness and misfortune. One way they prevent this is wearing amulets containing Quran verses. Muslims may not allow organ donations or autopsy since, according to Islam, the body should be returned to Allah in the condition in which it was given. That came from a book called In Caring for Patients of Different Cultures. For Asian Americans, it's a very diverse ethnicity, including Chinese, Japanese, Korean, Filipinos, and Vietnamese. The Chinese were the first to come to the United States. Asian Americans and Pacific Islanders represent very diverse populations in terms of ethnicity, language, culture, education, income level, English proficiency, and social political experience. That was from the Center for Mental Health Services brochure. Asian Americans tend to underutilize services because when confronted with emotional problems or psychiatric symptoms, they view themselves as shameful. Practices are not easily accepted by Asian Americans due to self-resilience, modesty, and dignity. Allowing outsiders in can be an uncomfortable experience. One thing I looked up and did research on was suicide. Suicide is a complex behavior involving many factors. Females have more attempts but lower completion rates than males. This is regardless of ethnicity. Protective factors such as family closeness and high religiosity are also found across many groups, but they tend to play a larger role in certain cultures. That was from the Encyclopedia of Multicultural Psychology. Cultural influences play a role, so promoting protective factors can help decrease your risk. Some stats we found for the cultures that we investigated were, for Asian Americans are less likely than white Americans to commit suicide. Older Asian American women have the highest rate of all women 65 or older in the U.S. The suicide rate is lowest during youth, and Chinese and Japanese rates increase with age. For African Americans, the rate is lower than the rate for European Americans. Females have a low rate, and risk factors for African Americans include poverty, racism, marginalization, age under 35, drug use, presence of firearms in the home, and violent behavior. That was from the Encyclopedia of Multicultural Psychology. For our interviews, we did email interviews. Megan interviewed a Cope Elementary School social worker, and here are her thoughts to our questions we asked. For question 1, her answer was sometimes and usually, but you can never assume or prejudge before working with a client. Again, I see this more than working with parents rather than students. Yes, especially with parents, but not so much with children I work with. It could be cultural or just different parenting styles, but I often see different styles due to cultural backgrounds. For question 2 about changing methods depending on culture or race, she said, when working with younger children, not always. I let the children be the teacher to learn about their culture and traditions if it affects the purpose of the need for social work and psychologist intervention. A parent interview is important to evaluate if parenting practices are influenced by the culture. For question 3 about has anyone rejected the idea or refused treatment, she said yes, parents have refused social work and psychologist services at school. It is their right to do so. For question 4, she answered, it can be challenging, but it tells me I need to learn more about their culture. Question 5 asked about, is it hard to understand patients when there's a language barrier? She said, yes, I feel that I'm not getting all the background information I need when interviewing parents and working with children. When using an interpreter, it is not the same as communicating in English. I feel I cannot always explain myself clearly, especially with parents. With younger children playing, it is useful. She said, yes, this is important, and she has used community agents to help with this when looking into a patient's background to better understand. For my interview, I interviewed a QIDP from Park Lawn Services. For question 1, she answered, I do not notice slight differences with participants that I have of different cultural backgrounds. When I work with them, I remind myself of what his or her culture is and what that cultural considers to be respectful or disrespectful. And with considering if he or she has the same characteristics as those of the same culture, I think it depends on the person and how he or she was raised and how they've grown up. For example, I think it depends on if they practice their religion or where they grew up. I also see that individuals with different cultural backgrounds have similar characteristics with each other. She said, that's a good question, asking about changing methods depending on culture and race. At times, I have to be aware not only of their culture, but also how they think or feel as well. For example, I have participants that are spiritual, so I can make references to God and their beliefs to help them understand things in certain situations. With some others, I have to be more sensitive to how they interpret things because they may take situations or events that are out of their control to heart. For question 3, she answered, I do not do treatments in my field. I am a QIDP at the Intellectual and Physically Disabled Service Organization. Some of my tasks include assisting individuals and make sure their needs and wants are met. I also run implementation strategies for participants. That being said, these plans and the needs of those individuals can vary due to cultural and religious beliefs. For question 4, asking about trouble with working participants and not knowing their cultural practices. I am a very open person, so I try to learn as much as possible about the participants I work with. I also spend time with them, so I get to know them better. I feel there is always room to learn and grow. For question 5, she answered, I could say that at times I have difficulty understanding individuals if they have trouble with verbal speech. Sometimes I have to have them say things more than once, or I may ask another individual to assist me when trying to understand what the person is trying to say. Some participants have communication devices and no sign language, which helps them communicate. I'm also planning to go back to school. I want to learn sign language. For question 6, asking about research of participants' background to better understand them, she said yes all the time. There is always room for me to learn and grow.